Hi everyone, welcome back to the Vision Refocus channel where we discuss all things eye health and vision related. I'm Dr. Kevin Cornwell, and today I wanted to go over how diabetes can damage your eyes and vision and potentially lead to blindness. I've been practicing optometry for almost 10 years now, and by far the number one reason we see patients lose vision is from diabetes. Diabetes can affect many structures inside the eye, but by far the number one area where diabetes can occur inside your eye is the retina. The retina is a thin sheet of neurosensory tissue that transmits all our vision back to our brain for processing. Whenever patients have bleeding or hemorrhaging in the back of their eye, it is typically in the retina, and the term we use to describe this is diabetic retinopathy. When we have prolonged periods of elevated blood sugar, there's not enough space in our blood vessels to transport oxygen and other nutrients that we need throughout our body. And this scenario can cause damage throughout the entire body, including the feet, kidneys, and eyes. Inside the eye, over prolonged periods of elevated blood sugar, the eye is not receiving the oxygen that it needs to function. And so what happens is the blood vessels in the back of the eye become leaky and bleed and break open in an attempt to bring more oxygen and nutrients to the retina. Unfortunately, this leads to bleeding and hemorrhaging and can cause a lot of complications with patients' eyes and vision. The crazy thing is that unless a patient's central vision is affected, a lot of times patients can have significant damage in the back of their eye with no visual symptoms whatsoever. This is why we recommend annual dilated eye exams, especially for those with diabetes. When patients do have visual symptoms from diabetes, these can include shifts in your glasses prescriptions that can come and go, but distorted vision, hazy or blurry vision, new onset flashes or floaters, or even like a shadow or a curtain obscuring part of your vision. As I mentioned, diabetes can affect many other structures inside the eye and increase your risk for many other eye diseases that we hear about, including cataracts and glaucoma. But by far the number one sign of diabetes in the eye is diabetic retinopathy. So when it comes to treating diabetic retinopathy, the severity will determine the treatment. A lot of times in early cases, we'll simply monitor every 6 to 12 months. In the more severe cases, patients are typically referred to a specialist where they'll undergo various treatments and surgeries, including injections in the eye and laser procedures to limit the bleeding in the back of the eye. Over the long term, the best way to prevent diabetes from affecting your eyes is to control your blood sugar. This includes routine follow-up care with your primary doctor, as well as implementing positive lifestyle changes. In one of the first videos we did on this channel, we went over several evidence-based strategies to prevent and reverse diabetic eye disease. We'll link to this video in the description below. These strategies include intermittent fasting, carbohydrate restriction, as well as managing your sleep and getting adequate exercise each week. If diabetes has affected your eyes, feel free to leave a comment and let us know what has helped you restore some of your visual function. Many patients that we see with damage to their eyes and vision from diabetes are cases that are completely preventable. Diabetic retinopathy is the number one cause of legal blindness in adults today. And it's really unfortunate because we're seeing diabetic retinopathy affect people of younger and younger ages, including those in their 20s, 30s, and 40s. And if left untreated, diabetic eye disease typically leads to permanent, irreversible blindness. When this happens, patients lose their sense of independence, they can't drive, they can't work, and they can't perform their normal activities of daily life. The good news is that most cases of diabetic retinopathy are completely preventable. As primary eye care providers, it's not uncommon for optometrists to diagnose type 2 diabetes before the patient is even aware that they have it. This is because the retina can show signs of diabetic retinopathy before the patient has any other symptoms in their body. If you have any further questions on how diabetes can affect your eyes and vision, feel free to leave a comment and we will get back to you. Also, if you have any ideas for eye-related topics you'd like to see covered in a future video, please let us know as well. For more information about diabetes in the eye, feel free to check out the other videos on our channel and subscribe. Thanks again for watching, and we'll see you in the next video.